Good afternoon, everyone. I'm Gary Summers, and welcome to the audio edition of Mind, Body, Soul, a show about your mental, physical, and spiritual wellness. I have a recurring guest with me, a returning guest, MJ Brown, who's been on many times before, and I would recommend if you go back and listen to her sessions that we did before. I would highly recommend them. They've been helpful to a lot of people. So let's get started. And I won't read out MJ's credentials because that would probably take way too long. You can see in the description on the video there that exactly what she does. So anyway, welcome, MJ.
Thank you, Gary. It's great to be back.
Yes, it certainly is. And I know I've been tracking you down to do this for a long time, and I know you've immersed yourself in a course on immunology and the immune system. So what a great time to bring this forward and to talk about our immune system, particularly in light of what people are going through now with COVID-19, and of course people who are immune system compromised. So I guess to start off, can you start by giving us an overview of how the immune system works? Like, how does it fight disease? How does it all work so it keeps us safe?
Right. Well, that's a good point to start with. So I will, let your listeners know that it's going to be a little bit technical for the first 5 minutes. But as we progress, we're going to connect the dots, and it's going to become a lot easier to understand, this whole immune system and how it works. So when you look at the immune system, so immune cells are made in the bone marrow. They migrate to the thymus, they mature, and then they're released everywhere in the body, and they gather in the lymph nodes. And then the environment in where they fall will dictate what they will become. So the immune system is like a football team. It's not just one type of cell. It's many different players, and they all have different roles to play. So what I'm going to start with is to explain 4 different grouping of immune cells. And that will be important to understand when we progress through this conversation, for people to connect the dots in some of the symptoms and conditions that they have or they may have. So if we start with the first grouping of immune cells, so the first group are efficient at killing bacteria and viruses inside the cell. So that's the first group. And there's also in that group, the immune cells that are cancer surveillance cells. So that's the first group. Now, the second group of immune cells are efficient at killing parasites. So that happens outside the cell. They produce a lot of mucus, and they also expel allergens. So people with allergies, pollen, dust, cat, dandruff, that is the type of immune cell they're going to make a lot of, will be these second group. Now, the first group I want to say is called Th1. The second group is called Th2. The third group of immune cells we're going to differentiate in the immune system promote tolerance. So it's good with autoimmune condition, as we want the body to tolerate the presentation of self-tissue. So when someone has an autoimmune disease, your own immune system is actually attacking your tissues.
Sure.
So the third group, if you're strong in that immune group, then you tolerate instead of reacting to your own tissues. These immune cells are called Tregs, T regulatory T cells. So this is important to remember. But as we progress, as I said, it'll become easy to understand.
Yeah, okay.
So the fourth group of immune cells are efficient at killing bacteria outside the cell. They're also efficient for candida or yeast or fungi overgrowth. And they also cause an inflammation response. So when we're looking at all these different types of immune cells, they're all important. They all play a role. There's no good or bad, but what we don't want is a dominance in any of those 4 categories. We want them to be balanced. So again, the first group, Th1, antiviral, antibacterial. So for when you have COVID, when you have a recurring infection, you want to be strong in these type of cells. The second group is your Th2. They make a lot of mucus. When you have someone with seasonal allergies, someone with recurring infections will tend to create a lot of mucus. Th3 are your T regulatory cells. They bring tolerance. So you want that with an autoimmune condition. You also want that for any inflammatory conditions like arthritic, gout, fibromyalgia. You want your immune system to be strong in that quadrant. The fourth one is called your Th17 cells. So those are the inflammation or the infection outside the cell, so antibacterial outside the cell, and fungi or your yeast. And that's where you would want to have a dominance, or not dominance, but some good immune strategy in that particular quadrant. Now, how they become one of those, like in which category you're going to make your immune cells, it depends on the environment that those new immune cells fall in. So you have an immune cell, it goes to the thymus, it gets released into the body everywhere in the lymph nodes. What influences them and what they will become depends on your diet. That's what will influence your environment. Your diet, stress influence the environment, your lack of sleep, or like your sleep pattern. If you have bacteria, if you have a virus, that changes the environment again. Hormones, liver detox. So if you have surgery one day, you're going to cause a lot of inflammation because your tissues have been damaged and now your body wants to repair. That also influences the environment in which which immune cell will become. Is it going to be a Th1, a Th2, a Treg, or a T17?
So when your immune cells are made, they become one of those four.
There's a few others, but those are the primary one. Yes.
Okay. So you said earlier that it's not good to be. It's good to have a good flavor of all four to be balanced, and you said it's not good to be dominant in one.
No.
What's problematic about that?
So when you become dominant in any of them, then you're going to have symptoms or conditions will arise. So if I give you a few examples of what falls in which category.
Sure. Yes. Okay. Do that.
Okay. So now you have people you hear, they say, I never get sick. I never catch a cold. Never, like whenever you raise your hand, that's
yes,
you.
That's me. You told me that. You told me I was dominant in, I can't remember which one you said, but I've never had a cold. I've never had the flu. I just don't remember the last time I was sick.
Yeah. So is that good? Is it bad? It's not always good, but it's not always bad. So we have to look at the whole biology, your whole history. Okay. So someone who is never sick, they have a lot of immune cell in the first group, the Th1 group, because remember the Th1 group are antibacterial, antiviral cells. So when you're dominant in that group, it's good, but what's not good is not always, but many times people who are dominant in that, they're never sick, they tend to have inflammatory conditions. So and why is because they are usually dominant in the fourth group, which are inflammation cells, your Th17 cells. So when you're looking at someone's biology or someone's history, it tells you where their immune system lies. So you're very dominant in Th1 cells. Obviously, your immune cells that are antibacterial and antiviral are very strong. So whenever you do get in contact with a bacteria or a virus, your body fights it. So you don't have the symptom per se. And so inflammatory conditions. So people, not always, but people who are strong in Th1 tend to have rheumatoid arthritis, RA, osteoarthritis, osteoporosis. So any osteoporosis is not a lack of calcium. It's an inflammation that's not resolved, and that tips you towards a Th1 cell. And when you have a Th1 dominance, you actually stop or you don't stop, you produce more osteoclast. So osteoclast is the group of cells that makes bones. Osteo, bone, clast, degradation. So there's more, did I say make more? No, the opposite. It increases the bone degradation.
Yeah.
So you have to stop the inflammation, or you have to resolve that environment that causes inflammation to stay high, to resolve osteoporosis, or to slow down, or to nullify the osteoclast.
Okay.
So same with gout, same with fibromyalgia, they're all inflammatory conditions. So that's the number one example. Now I'm going to say everyone has a different biology. So I can see clients come in and they have rheumatoid arthritis, but they also catch colds all the time. So if they're always sick, that means they're not dominant in Th1. They will be more dominant in Th2. Because if you look at your second category, initially when I spoke about, they make a lot of mucus. And the Th2, when they're dominant in Th2, you will always be deficient in your first category, in your Th1, which is antibacterial, antiviral. So if you create a lot of mucus, so someone who creates a lot of mucus, that's the perfect environment for bacteria to grow. So they tend to have recurring infections. So people who come in with sinusitis, rhinitis, dysbiosis like IBS, they eat something, they have diarrhea every day. People with UTIs, recurring UTIs, or even asthma attack, allergies, anybody with seasonal allergies, they tend to be dominant in the second group in producing a lot of mucus.
Okay.
So what can tip you there? Why is it that people end up in those categories? Well, I said it earlier. Maybe they're on medication that tips them there. Because if you're on steroids, that's a Th2 promoter. If you're someone who drinks 5 cups of coffee a day, coffee is a Th2 promoter. So it will increase mucus production. If you're someone who eats a lot of dairy product, that creates a lot of mucus. So you're tipped towards that inflammation. You have stress in your life, tip towards Th2 again. So then you fall into a category that you're unable to fight infections. So you become Th1 deficient, which is your antibacterial, antiviral immune cells. You produce less of those because go back to what I initially said.
Right.
When you make new immune cells, wherever it falls will dictate what it will become. Will it become a Th1, a Th2? So then you can switch your biology. So there's every condition out there will be able to tell you where you fall. So someone with a history of malignancies or cancer, or they have a current cancer, I initially said that your Th1 cells are cancer surveillance cells. So we know that if they have malignancies, they're deficient in Th1.
Okay.
So we want to make sure that we boost that particular part. So that's just to give. And one last point I want to say, because I see so many clients who come in with food sensitivities, they react to everything. They start off with one thing, then it's 2, then it's 3, then it's 4. Because when you have inflammation in the gut, so now that will tip you towards a Th2, then you lose the tolerance. So the gut is a place where you make a lot of the third category, the tolerogenic type, tolerance type of your immune cells. So you tolerate food. And why I say you tolerate food is because your immune system reacts to protein. And you don't want to react to your food because that's where your protein comes from.
Sure.
Not just fish and chicken and that, also gluten. Gluten is in carbs, but it's a protein. So you want to increase tolerance. So you would boost the immune cell that's in your tolerance. So that's kind of like how this all works.
Okay, so based on your preponderance to a certain issue that you have in your life, your body recognizes that and it sends the immune cells to that particular area to help that area, but it ignores the other areas. Is that kind of a simplistic way of looking at it?
Well, kind of, but it's like the immune cells, like picture 200 kids in a cafeteria talking. That's your immune system. There's a lot of conversation happening all at once, and it's never one part. It's always but the dominance what you don't want is becoming dominant in one area, because your symptoms will tell me where you're dominant.
Okay.
So it's very symptom. So someone who's like let's say someone has low kidney function. A low kidney function is a result of fibrosis that's being made in the kidney. So you lose the kidney function because you have more fibrosis type of tissues. If you're dominant in your tolerogenic cells, your T regulatory cells, then you will increase the formation of fibrosis. How do you get tipped there? So people get in trouble when they decide that I'm going to start taking curcumin because my best friend said that it's good for inflammation.
Yeah. Okay.
Okay.
Yeah.
So, or you go to Mr. Google and it says, yes, it's great for inflammation. So start curcumin. Well, curcumin increases your environment. It changes the environment towards T regulatory cells. So that's what curcumin does. It actually boosts your tolerance cells, but that's okay if someone has arthritic conditions, but not so good if you have a low kidney function, because
Sure.
it's going to also increase your fibrosis.
Okay.
So that's where, we're starting to connect the dots now. So I just gave you one example.
Sure. Okay.
With curcumin.
What about antioxidants? We hear a lot about antioxidants and how good they are. What are your views on that? Is it good to take or any supplements? Because in
Right.
some of the research that I've done, there's really not much out there that I found that is good for boosting your immune system.
Right. So actually, that's a good point. The last one you said, boosting your immune system. My question is, which part do you want to boost?
Okay, so
Because
it's not right. You just don't boost all. You boost.
No.
You. So people come to you. You are the person who, through what you do, is able to pinpoint what's deficient and what needs help. One of those
Right.
four.
Right. Because this is all scientific. It's not just, okay, let's try this and see how you do. Because I don't want to burden your listeners with all the technicality,
Sure.
because
Yeah.
we can talk about NF-kappa B and TNF alpha and all
Yeah,
that. Those
sure.
are all inflammatory cells. They don't need to know. That's the whole conversation that's happening in the cafeteria.
Right.
That conversation changes the environment that tips your immune cell in one of those four.
Okay.
So when someone comes, okay, so you talked about initially about antioxidants.
Yeah.
So I have lots of clients. I see a lot of cancer patients. So they come in and they say, I drink carrot juice, I'm on green juicing, I do berries, I do lots of antioxidants. Antioxidants changes your environment towards favoring T regulatory cells, your tolerance to the immune. So your immune system tolerate what's going on.
Okay.
That's not good. And it's not bad. It depends on the person. Remember I said that your Th1, your first group, they are antibacterial, antiviral,
Right.
and cancer survey. I know I'm repeating myself.
No, it's good. No,
it'll be good for your listeners.
Absolutely.
Right.
Yes, go back. Yes, absolutely.
Right. So anti-cancer surveillance. What you don't want is if you take antioxidants by the load every single day and you're drinking your juice, but you have a cancer diagnosis or a history of cancer, that means that you had been tipped towards not being efficient at your cancer surveillance. So if you do antioxidants are a massive boost of tolerance. You're actually tolerating your cancer cells. You do not want that. So that's why someone with their own biology tells me or tells the practitioner what they will need at that moment in time. So
okay, so that I don't lose the thought, you said to me a long time ago that physiology always prevails over pathology.
Correct.
And you just mentioned then that you don't want your body to tolerate cancer cells.
Not all.
You want right. You want your immune system to fight those cancer cells. Is that what? Is that it?
Yes.
Because if you tolerate it, then I guess it will get to a certain point where it won't be able to tolerate it. It'll overburden the system.
It will become a tumor.
Okay,
because
right. Okay,
right.
Gotcha.
We have mechanisms to actually destroy cancer cells when it's a cell. Your immune system is not very efficient at breaking down a tumor, but it's very efficient at catching deficient, mutated immune cell or cancer cells or cells that have become cancerous. So, like there's 50 shades of gray between healthy cell and neoplastic, which is like cancer. Mm-hmm. So you have several mechanisms. So we have an immune cell that falls in the first category, which is called NK cells, natural killer cells. Those are very efficient at killing cancer cells. So to go back to your antioxidants, I say it's good and it's bad. It's not necessarily, it depends on the biology we're trying to change. So someone who has an autoimmune condition where their own immune system is attacking their tissues, we want to bring tolerance. So now the antioxidants would be good for that group because they would now, instead of presenting tissue to their antibodies, their adaptive immune system, they would actually tolerate the tissue.
Okay.
So that's why the conversation that we're having today is there's no good or bad. It's just what is in front at this moment in time.
Right. Yeah. What do you do at this point in time that's best for you?
At this moment in time, and at this moment in time is important because as we change the environment, so let's say someone comes in, they leave with a protocol. The protocol they leave with is only from what we've discussed today, but they go implement the protocol. They have some supplementation, they change their diet, they might review their medication, they start changing their lifestyle. Then they come back. Now that their report to me will be, or to the professional will be, have you seen any improvement? Where are you today? Have we changed your biology? So if we change your biology, we don't keep the same supplements. We don't keep the same dose because a flare of a condition will have a certain dose. But once it's starting to calm down, that dose is going to change. And eventually you may not require any supplementation. So supplements are key to change the environment many times.
Okay. Exercise.
Good or bad, or
or indifferent, or is it good? Is too much too much? Is what?
It depends. Yeah, it depends again. Exercise is good, but as we age, too much exercise may be too much for the immune system to actually repair the damage, because our life is all about damage and repair of damage. And where's the balance? So the thing with exercising, when you exercise, it really releases a lot of the inflammation cell called interleukin-6. How that relates to someone who they might look at their next blood test is if you have your CRP, C-reactive protein tested, that's your your inflammation. When someone has an autoimmune, that's pretty much what they test.
Sure.
But let's say they want to test and you're going to have your CRP tested and you went for a major big hike the day before.
Yeah.
Your CRP is going to be elevated.
Sure.
Because you've broken down tissues. So it depends on the person. So many times someone who, you hear of people starting to train for a marathon, and right after 2-3 months of training really hard, they end up with an autoimmune, or they end up with a flare. It can flare your autoimmune because that's the part of the immune system. Your fourth group, your Th17 group, which is inflammatory cells. Inflammation is good, is when you don't have resolution of it.
Sure, yeah.
And so when you're exercising a lot, there's a lot of tissue debris. Over time, when you have an autoimmune, your immune system is unable to keep tolerating it. Then it presents it to the adaptive.
Okay.
So
overweight.
Right. So someone
is being overweight and to the point where you may be bordering on obese. How does that affect your immune system?
So being overweight, it does not necessarily come with health issues, but the one thing that happens with fat cells are actually quite active. People think that they don't have a whole lot of metabolic output, but they do. Like fat cells are drivers of Th2 cells. So Th2 is your mucus producing. It creates, because fat cells release a lot of estrogen, and estrogen is a Th2 promoter. So then you have people who may be tipped towards a lot of infection. And if you're obese, then you're higher risk of high blood pressure, type 2 diabetes, and the metabolic syndrome, which also tips you into that Th2 dominance.
Okay.
So then your immune system, so of course it can bring some immune, draw on that particular quadrant.
How much, is there a certain age where our immune system becomes severely compromised, or is it just happen over time? Or how big of an impact is age on our immune system? And people talk about with COVID-19 and the compromised population of over 70 or whatever that is. What can you speak to the age part, and is there something the elderly can do to kind of help themselves with this situation?
Well, when it comes to the immune system, it does weaken with age. There's this premise that after you can't reproduce anymore, your body couldn't care less if you stay alive. So there's a lot of protective mechanisms that go down. But in terms of the immune system, as I said earlier, T cells are made in the bone marrow. They mature in the thymus gland, and then they're released everywhere in the body, and they get, they accumulate in the lymph nodes. As we age, we have less production of these naive immune cells being made in the bone marrow. So your pool is decreased as you age. So that's the number one.
Is that right across the board? Everybody is in that boat?
Not so. There's going to be variations because it depends on how many infections, how many viruses, how many situations in your whole life that your immune system was called ongoing to try to get rid of something. So let's say someone is 70 years old and they have a history of sinus infections and urinary tract infections. They will go through a lot more of their immune cells that are antiviral and antibacterial than someone who doesn't.
Okay.
But also, when you're looking at age, each person has about, and bear with me for a minute here, because it is important.
Yeah.
Everyone has about 100 million different T cell receptors. So we have receptors where your immune cells will have an affinity to connect to a pathogen. So if you have a pathogen, you have receptors for them.
Okay.
As we age, we burn out these receptors.
And we burn those out through infection and inflammation and that type of stuff.
Exactly, uncontrolled. If
Right.
you're not bringing control to your existing conditions, you are actually you're less efficient at getting rid of pathogens. You become less efficient.
So antibiotics would be problematic if they're taken over an extended period of time?
Not necessarily. What happens with antibiotics, some people just are not good at getting rid of infections. So when we're looking, there's two types of infections. There's the one that you absolutely need to kill, your acute infection like septic or typhoid or, tuberculosis, like you need to get rid of them.
Sure, yeah.
But when we're talking about bacteria that sets up shop in hollow space, like in your intestine, in your sinus, in your bladder, and so on, and you have recurring of those, now you're looking at your immune system is constantly asked to try to get rid. So antibiotics sometimes are necessary.
Sure, yeah, sure.
But you can use natural remedies as well.
Okay.
As you get older, you will need outside help. So older people tend to be a lot more they use more antibiotics because they're unable to get rid of an infection. But that's when I would say older people would definitely need, if they tend to be sick all the time, is to take a Th1 booster. So what are Th1 boosters? So there are so many supplements out there. Every supplement will change the environment, as I said earlier. Vitamin C is an antioxidant, but falls into the Th1 boosting. So I would say to people, But it's not that simple. It's not, okay, I get recurring infections, I'm going to take vitamin C.
Sure.
It all depends, because if you have an inflammatory disease, it's going to be going against you. It's not always, there's a fine balance between everything, but berberine, skullcap, ginger, those are all Th1 boosters, where curcumin, fish oil, vitamin D, vitamin A, quercetin, resveratrol, those are all anti-inflammatory. They're also antioxidants, and they are promoting T regulatory cells.
Okay.
So that would not be recommended for an older person, because that would bring tolerance to their infectious process. So if we're looking at infections, you see, am I losing?
Oh, no. Go right ahead. So anyway, you continue. I'll save my question till you're finished.
Right. So there's also one other thing I want to bring to when you age. As you age, so we have a master antioxidant in the body that's made by the liver, and it's called glutathione. Glutathione is your master antioxidant. It keeps your NK cells, your natural killer cells, which are very efficient at killing bacteria and killing viruses, or quieting them down enough for your immune system to take over. When you age, you lose glutathione, you make less. So to circle back now, I forgot to say, to circle back to your antioxidants and your berries and your green juicing type of people, they actually reduce, so these are antioxidants. So they reduce the oxidative stress, the reactive oxygen species that we make every second of every day. That's how, we age.
Sure.
When you take too much antioxidant, that actually kills glutathione. It just reduces, you don't produce it. So if you don't produce glutathione and you take too much antioxidants, you're not going to be very good at killing bacteria and viruses.
Is there one, you talked about vitamin C, is there something that someone could take right now without knowing what dominance you have, T1, Th1, whether those four, that you could take right now that could be like a general supplement you could take without having a diagnosis from somebody like you to be able to do it? Is that a possibility?
Oh, that's an interesting one, because I always have these questions. What can I take? I don't want to, I don't want to know X, Y, Z. I just want to take.
Right.
Well, I mean, there's always going to be a tip towards everything you do changes the conversation in the cafeteria.
Sure.
Put it that way, always.
Yeah.
So let's say, okay, I see people, they want probiotics, they want fish oil, they want zinc, vitamin C.
Yeah.
So, I mean, okay, but if you have recurring infections, let's look at fish oil for a minute. Fish oil is not good for everybody. So fish oil has over 7,000 research on them. It's all great, but fish oil, so when you actually, the way the immune system works, is we're talking about the immune system today.
Yeah.
The way the immune system works is it presents antigen, it presents stuff to your adaptive immune system for your adaptive immune system to get rid of it. Okay?
Yeah.
Fish oil, so there's a messenger in between the pathogen and the immune system, and they're called dendritic cells. So these dendritic cells, when you take fish oil, it actually anchors them in tissues, so they don't present anything anymore. So someone that has a recurring infection, someone with urinary tract infection, sinus infection, asthma, bronchitis, gut, IBS, dysbiosis, and they take massive, like one teaspoon, 2 teaspoons, or I don't know, like 3 grams of fish oil every day, they're not going to be efficient at killing their bacteria. They're pathogen. So it's not recommended. And what we do in these cases, we actually tell them to take coconut. Coconut is a saturated fat, and saturated fat actually increase the presentation of the pathogen to the adaptive immune system.
Okay.
Healthy fats are necessary. If you don't have healthy fats in your diet, you are not going to be very good at killing pathogens. So there's a physiology or biology balance with healthy fats. And I say healthy fats, I'm not talking about full fat cream and cheeses, because people talk about the keto and they go on this very unhealthy saturated fat. But coconut is a saturated fat, but it is a healthy fat. Lauric acid is antibacterial.
Okay.
So
stress. Now we can talk
Are you
about
stressed yet?
no, we can talk about, I guess the problem I've got with this is people say, well, stress can create problems, obviously, for everybody in with gut health, with everything, with the release of cortisol and all of those issues, and say, you know, you do what you need to do to have as little amount of stress in your life as you can, but no one ever tells anybody how to do it.
Right.
No,
You can't say
especially,
to someone, don't be stressed.
exactly, relax. I
It
mean,
doesn't work that
sure,
way.
they've never relaxed in their life. So how do they,
Yeah.
how are they going to do that now? So I guess maybe, are there some things that people can do? We talked about sleep, but I mean, if you're stressed, you're probably not going to get a good night's sleep. If you have a low stress threshold, people will panic over something that comes on the news, and you know, when you look at the COVID-19 cases and they're on the way up, people would get stressed over that, and they'll tend to hibernate,
And then
even though
wait for a couple, yeah.
they're probably fully vaccinated, but
Mhm.
they have this fear that, you know, something terrible is going to happen. So uh, when we how serious of an issue is stress with our immune system?
With the immune system.
Yeah.
Oh my gosh, it's a central player, because as you know, if you're stressed, you can have ulcers. If you're
Mhm.
stressed, you can flare your autoimmune. You're good and you get, so stress can actually add, is the straw that breaks the camel's back to your
Mhm.
existing conditions.
Yeah.
So when you have conditions, you have it's inflammation. So any chronic disease is actually an inflammation that's not resolved. You add stress on top of that. You mentioned cortisol, and you're right. What happens with cortisol? Cortisol goes up, then we have receptors for cortisol, but then it's not acute stress that's the problem. It's the chronic stress.
Right? Day to day. Yeah.
Day to day. It's not
Yeah.
like I'm going bungee jumping.
Right.
There's a start
Yeah.
and there's an
Yeah.
end.
Yeah. Exactly.
Right.
Yeah.
So it's when you have, you know, ongoing, what happens is you lose receptors. So then cortisol accumulate in the body, and cortisol releases an inflammation cell called NF-kappa B, which is it sets you inflamed. And if you're not able to process cortisol, then it's going to add, like, don't look at cortisol as something that stays in the brain. It's everywhere in the body.
Mhm.
And not just that, inflammation is not only to one area. If you have sinus infection, there's going to be inflammation everywhere, because
Mhm.
you're not holistic as the whole body.
Sure.
So when you're having, you can take things like what I recommend when you have someone coming in and they're unable to deal with stress. I mean, we add what we call adaptogenic herbs. So like ashwagandha is one of them. So ashwagandha, how it works, it doesn't reduce stress. You're not going to feel less stress. What it does is it improves the biology of cortisol. You're able to reduce cortisol. So instead of having cortisol that would be high up here,
Sure.
it brings it down, but it doesn't necessarily make you feel better. So I don't really want to be diving too deep into anything with cannabis, but
well, that was actually my final question before I wanted you to kind of sum up and give somebody something that they could use right now. That was my final question, was smoking marijuana, marijuana,
or vaping,
and
right?
vaping, or CBD oil. What
Right.
what are the effects of those on your immune system?
Well, it makes you deal with the inflammatory stress chemistry better. So it just reduces the stress chemistry. So we have receptors, we have the endocannabinoid system. And again, I'm not an expert on cannabis at all, but when you take cannabis, CBD, I mean, all the studies, the little studies that I've done, is that it's a combination of both CBD and THC. A lot of people don't like the effect of THC, but if it's to reduce stress, CBD is more of the one that works. And it's all about calming down the receptors. So when you saturate these receptors, it calms things down and you're able to process the chemistry of stress better.
What would you say to someone who Tobacco. Someone who is a high stress person who has a cigarette and it causes them to relax. Is there a tipping point there? Or is it okay for the person to have the cigarette even though he's putting all these chemicals in his body, but it's also helping him to relax? You know, that's kind of a contradiction in itself.
Well, it kind
right?
of, well, yeah, because I mean, it has a lot to do too with their addiction
Yeah,
to nicotine. But I'm in, not to say that, you know, I would know exactly how everything works, but one puff is a million free radicals.
yeah, exactly.
So if you have all these free radicals, the one thing, you know, it's not good. I would never say that smoking is a good thing, but it will definitely increase, like it's going to make your immune system work on over time.
Okay. Okay.
And just to circle back to when you get older, also, I didn't mention this, and it's not something that people have tested, but we all acquire bacteria and viruses throughout our life. And some viruses become very active in older age. So the two that are very active are called EBV, so Epstein-Barr virus, and CMV, cytomegalovirus. These two are, we get these, most everyone gets those when they're young. EBV is mononucleosis. A lot of people say, I never had mono, but you may have been in contact with and you didn't even know it.
Sure, yeah.
So when you have a process that's always, you know, like a little bit higher than it should be, and you can test for those, and we can calm these down. From a holistic point of view, we have remedies that we can calm these down. But what happens is it draws constantly on your immune system because you have a virus that's now active, and that's very, very common with older people.
Okay.
And they don't even know, but they're unable to fight any infections. So they tend to be more infected. So that would be one thing to look at, to say what is the state of these two viruses, and what can we do to actually calm those viruses down? You can't get rid of viruses, but you can calm their activity.
Sure. Okay. MJ, a great conversation. I certainly look forward to chatting with you all the times you've been on. So just to clue up, is there anything general you could say to our listeners as far as what they can do for general overall immune health? Just kind of sum it up in a nutshell to
Yep.
to kind of help people that they can do immediately, kind of thing.
Well, I always say to everyone I see, don't ignore your symptoms, because they're a gift that your body is giving you, that something is not balanced and it has given up. It can't rebalance it. So you end up with a symptom. And seek advice, seek, what to do. And sometimes you do need medication, but other times you don't. And it might be a change in your lifestyle. So don't ignore your conditions. Don't ignore any symptoms. And I always say too, many cases you need medication, but many times your medication, you're not controlled. Your medication is controlling it.
Sure.
So it's all about, making sure that you listen. And I wish I could say, yes, everybody should be on these 3 supplements and this specific diet, but it doesn't work like that. It's got to do with their own biology.
Sure. And I guess that's why people come to see you.
Well, yeah, well, we try to change the environment to make people feel better.
Yeah. Anyway, MJ, again, thanks very much for taking the time out of your busy day to come and speak with us. We really appreciate it.
Thank you so much for having me.
That's it, everybody, for this week. We'll be back next week with another interesting guest. Bye-bye for now.